Hello and welcome to Coffee Talk Tuesday. My name is Shalise and I am here with my very manly, not lovely co-host, Trip Mitchell. Was that better?
It was very hard to have that transgender operation during this period, but I'm feeling much better about that description. Thank you.
Oh, you're welcome. And our guest today is Megan Walker, and I'm going to give a little backstory of how I met Megan. So I, as you know, work for, well, my nonprofit is Rainy Days Foundation, and I work with kids with congenital heart disease. And Megan is one of the nurses up in that unit, or was. I think, are you still working at the same Primary Children's, but in Riverton, or were you always in Riverton?
I was not always in Riverton.
Okay, I didn't think so.
I am still shared though, so I still float out there when we're overstaffed and they're understaffed.
And she's one of the favorite nurses that this unit has. No, seriously, every single one of my moms are like, we love Megan. So,
well, I love them.
So the reason why I asked her on today though is because she has had some major changes in what she's doing, and I'm going to let her talk about that, but it is due to COVID-19 and what we're seeing here. And so I thought it would be interesting to get some of the behind the scenes with somebody who has been directly impacted in the medical world. So Megan, go ahead and share what's going on.
So the beginning of this month, it was actually April 2nd, our unit found out that the surge plan for Intermountain Healthcare, so I'm on a peds unit, okay? Adults are not my thing. But we found out that the surge plan is that our unit would be transitioned into an adult COVID-19 floor. And honestly, when I was talking to my boss initially, so my nurse manager called, they had like a big meeting, but I missed it. It was like a phone call. I wasn't able to attend. And when she told me initially, I was like, actually like, okay, like it didn't really hit me yet, you know? And then I walked out of my office and into my kitchen, and I saw my husband and I saw my 4 kids, and it kind of just like hit me, and I like had this like wave of emotions, because I've been a nurse for a long time and I never considered my job being something that could potentially put my family or like my loved ones at risk. And I think especially even during all of this COVID-19 stuff, I was like, well, I'm a peds nurse, like I'll be fine, you know? And so it kind of just like hit me, and I was overcome with a lot of emotion, and I felt this urgency to just like capture that in the moment. So I actually did a video of myself and just like kind of talked through my feelings of what was going on. And I didn't know at the time if I was going to post it or not, but I knew that even myself, I was taking the stay home, stay healthy thing seriously to a degree, but it just like was brought up to like this level in that moment, you know, just realizing that like, if I'm going to be taking care of these people, like I really need to isolate myself because I have the potential of infecting somebody else. And so I decided to go ahead and share that, and really just with the hope to encourage people to stay home and stay safe, because I no longer had that option. Now, while it kind of like brought me through all different types of emotions, I also felt incredibly grateful because my team at the children's unit at Riverton Hospital is incredible. And really the other option would have been like if our census was low, because really the pediatric population census in hospitals in Utah has been low because we're not spreading disease. We're not hanging out at schools. And they're like canceling elective surgeries. So the other thing would have been that we would have been redeployed to random places throughout the valley. So it was the most ideal of an unideal situation to be able to do this, but with my team.
Right.
Now, we actually have not gone live with that. So it was supposed to go live. So April 2nd is when I found out. We were supposed to go live April 14th. So basically, April 10th, we were going to stop admitting pediatric patients up to our floor. We would have transferred them up to main campus Primary Children's if they needed hospital care. And then if there were still patients on our unit, at that point, we would have transferred them, and then we would have been transitioned to a COVID-19 floor. Now our numbers in Utah they're actually better than what was projected. And so they pushed that date out to April 20th, and it's currently pushed out to May 27th, which is great. Like I love that because it means more people in Utah, more individuals in Utah are healthy. Like we're staying safe, we're healthy, and it's not as bad as we thought it was going to be. So less lives are being negatively impacted. But during this time, because we've been training, we've been talking to people that are out in New York and Washington. We've been hearing stories. I've spent time in the emergency room on the med-surg adult floor just to get my training and to re-expose myself to the adult world, you know, to make sure I don't like go into a room and be like, hey buddy, because that's how I talk to my and it's just been like, it's been really humbling because it's hard, I feel like, for us to really understand the reality of this situation because we don't see it here, really. You know, we've seen some. There have been people that have passed away. I have a friend that her grandma just recently passed away here in Utah from COVID-19. So it is happening, but not on the scale or the level that it's happening elsewhere. Like, I actually have coworkers. There's about a group of 100 from Intermountain Healthcare that volunteered, respiratory therapists, nurses, techs, doctors, because we're so overstaffed right now to go to New York. And so I actually have coworkers that are there right now that I've been communicating with, and some that have come back and shared with us. And it's just like humbling because they talk about the truckloads of like deceased people that they don't know what to do with or where to put, or they talk about like family members begging to come inside because they don't allow, even at the bedside when they're passed away, because of the risk of spreading that infection to that family member and them taking it further, to even come in and say, you know, be there for the withdrawing of life of care. So it's just, here we haven't seen that magnitude, but it's happening. And so I feel incredibly grateful that it hasn't been as bad as we anticipated. And who knows, maybe we will have a surge and maybe I will end up caring for those patients. But I don't know. But I do still want to do something for those individuals, for the healthcare workers that are, you know, that are in the front lines, and for the ones here that are preparing. And so I have decided to like give back. I have another business that I do on the side in addition to nursing. And I've decided this month I'm actually going to give back 50% of my proceeds to the relief aid of healthcare, like COVID-19 healthcare workers.
Do you feel like Intermountain Healthcare and the medical community has given you all the tools you need to practice a great level of medicine, but most importantly, be safe?
100%. They keep us updated. Stuff does change. So that's the hard part, is this is something that healthcare workers and the CDC is learning about, you know, about how it's spread, how long it lives, and all of those things. So the regulations and whatever change regularly. And so we get new, but we are continually being updated. I feel like they put a plan in place far ahead of time so that we could be trained and ready if that happened. The other thing that's pretty amazing, because actually when this all started, a lot of nurses were losing hours, especially at Primary Children's. Like, we would be in bed control and they would be over like 45 nurses. So that meant 45 nurses going without pay. But they've since created this COVID budget. So if we want to work, we are guaranteed our hours, and we can come in and use that time to train for COVID, or to go, like I've done, like rotations on the med-surg adult floors in the ED. So yes, I do feel like Intermountain has done a really good job at keeping us up to date and giving us the resources we need to stay safe.
Oh, sorry, go ahead, Trip.
So this weekend, I noticed for the first time in the last 5 or 6 weeks, it seemed like on Saturday in particular, everyone was out. Projects were going on. The hardware stores were packed. It seems like with the nice weather, people are starting to relax their standards. As a healthcare worker, especially since you've got friends and coworkers back in New York, what would you say to the people listening and watching this show?
You know, we've still just got to be careful. Like, honestly, I just don't think we know enough about the disease to just like go out in the masses again. I do feel like the potential of us opening things up in a regulated way would be okay and appropriate. I know they talked about doing that, like the governor talked about doing that like May 1st. But I do think it would need to be regulated. Temperatures would need to be checked. Masks would need to be worn. Like, those things would need to be demanded. But I agree. I think even like, I don't know, anytime I had gone to Walmart, I was just surprised that that was never a requirement for you to go into the doors of Walmart or Costco to have your temperature checked. Because you'll have a temperature far beyond, like, you can have that a few days before you have any symptoms, you know, and that's when you're the most infectious. And so it surprises me that that hasn't been a thing right now in the first place.
Do you wear a mask everywhere you go outside the house?
Yes, if I'm in a public place, like outside of my car, then yes, I will.
Yeah. Shalise, how about you?
I actually have only been to the store twice during this whole thing. And I did not wear a mask.
Well,
the first one was before it was really a thing. The second one was right before Easter. And so it was starting to become a thing, but it wasn't quite that mandatory. And honestly, I go and I get my groceries online and I go and pick them up. And I haven't been anywhere except for those two places. And I should have worn a mask the second time, because that's when it really started talking about it. But one of my heart moms is actually going to send me masks for me and my kids. She's like, my mom makes them, we're sending you some.
Well,
I was like, well, thank you.
And Shalise, the other thing is, after your last probation for bank robbery, I know
Right,
you're not allowed to wear a mask.
That's how people know me, is just like this.
I mean, and for me personally, I feel like, I could be exposed at the hospital, not know it, you know? So I feel like for me, I should, like, it's like a civil duty of mine to wear it, because, like, for example, there was a patient in the ED before. Now we wear face shields with any respiratory patient, whether or not they are being ruled out for COVID-19, because sometimes they'll present differently, and then later you find out they're actually COVID positive. Like, there was one patient in particular that he had gone to like CT and all these different places, and it wasn't for like 3 days until they diagnosed him with COVID-19. So there were several healthcare workers and individuals that were exposed. And so now it's just like across the line, we treat any respiratory patient, any fever patient that has any of the symptoms as a COVID patient.
That's probably really smart. But we wear masks really not to protect ourselves, but to protect other people. Is that effectively how it works?
Yep. Yeah, just so you're not spreading your droplets from your mouth to other people. So I think if we're just smart and we're conscious, you know, we're washing our hands, we're wiping things down, like, I feel like we've done a decent job. I mean, there are some, like, we were in the ED. I was in the ED for that shift, and there was a family that came in that was like irate and said that COVID-19 doesn't exist. Like, they were just like yelling and going crazy. So, I mean, I think there's an extreme of that, and then there's, you know, so I just think if we are all just doing our best.
Were those people wearing a Make America Great hat?
Probably. Every show.
Well, it's just low information anti-vaxxers are idiots, but they're irresponsible, because, you know, vaccines only work if everyone take them.
Right.
And these people are just such nimrods.
Well, I think too, it's like people rely so much on information from social media, where it's like, where is that information coming from?
Right.
Is it true? Is it not? You know?
And for sure, we should not shoot Clorox into our veins, correct? Just want to get that out there.
That?
Well, that's what Trump said.
Yeah,
No.
Trump on Thursday musing about it on national television. And So there's a lot of misinformation. Social media is really a problem, isn't it?
Yeah.
Yes.
Well,
Yes, it can definitely be a problem.
On that note, I think we should take a short break. And Megan, I have a couple more questions that I want to ask you when we get back about your experience with some other things that I've heard on social media. So
Okay.
We'll be right back.
Okay.
All right, welcome back to Coffee Talk Tuesday. I'm Shalise Stevens and I'm here with Trip Mitchell, and we are speaking with Megan Walker, a wonderful, amazing nurse at the Primary Children's Unit at Riverton. That's your main place now, right, Megan?
Yes. So that's where I'm based, and then I will still float out to main campus.
Hey, Shalise, can I interrupt you just for a second?
Please
to
do.
talk about how amazing Primary Children's is?
Do it.
I was lucky enough in my 27 years in Vegas to work with a children's charity, Nevada Childhood Cancer Foundation, and whenever we had a kid who was really sick, Primary Children's was the resource for a lot of really sick kids in Vegas, and it's the gold standard for pediatric care in the world. And
Hands
parents
down.
are so lucky to have that as a resource here in Utah. And now, especially because you've got Riverton, and then I understand that you're going to be having a big campus down in Utah County as well.
Yep, in Lehigh. Yep.
Oh, that's fantastic.
And it will
That's
be
awesome.
a standalone primary children's hospital, so just children's.
Oh,
That is
that makes
fantastic.
me, yeah, that makes me so happy because I know people, of course, you know them too, but with my heart kids that come from all over the place, and so they're a 3-hour drive to Primary Children's Hospital because they live in Fillmore, and so Lehigh, I mean, that's 20-30 minutes closer, which is awesome for them.
Yeah, and Trip, I will second that. I've actually worked in Florida as a pediatric nurse, and hands down, I was spoiled, because I left Primary Children's, went to Florida, came back, and just the resources, they think of everything in your child's care. Social, mental, physical, all of the things.
So Megan, do you know what the top healthcare provider in the state of Nevada is?
No.
Southwest Airlines, because people literally call Southwest to get a flight to Utah.
You know, my sister's a flight attendant. She got, CPR training and stuff.
Okay, well, it's perfect. But what Primaries does is just amazing, and the level of care and the anguish and the heartache that the medical staff goes through. You know, for every win, there's some losses out there, and that has to be the hardest thing that you can ever go through.
Yeah, and since I work with people there as well, I mean, you always hear stories, you hear the good, I hear the bad, and, really, because I haven't been a nurse or anything like that before, but I've worked in the medical field, and there's always something bad that comes with good, but ultimately, I think that where their hearts are at Primary Children's that's their hearts are in the right places. Their intentions are always good. And the thing is too, and this is my little pitch about the medical world. Everybody looks at doctors and nurses like they should be gods. Like they should know everything, that they should have all the answers, that they should never make a mistake.
Well, I do.
Well, but you're the one exception. But I think that it's important to say that they are human and they will make errors. And I know it's so scary because a lot of those errors are if we're talking about primaries, that's your baby, that's your child that they're possibly making those errors from or to. But ultimately, I mean, I think that everybody that I've met and there are really wanting the best for the child. And there's always people, there's also people too that are burned out, that should take a vacation because they need to just step back and do that. But I mean, I think ultimately in the grand scheme of things, I completely agree. Primary Children's is very near and dear to my heart. And one cool thing about this that I'll just go ahead and share, because this is how important Primary Children's is to me, is that's where my little boy passed away. And well, he passed away before he got there, but that's where they had him. And it took me, it'll be a little over 16 years to finally be okay with them putting his name on their Celebrate Life wall at Primary Children's for donating his heart valves to save another child's life. So I'm doing that in August, which is super cool. So anyway.
So Megan, what are the real winning stories that you see at Primary? I know in the case of pediatric oncology that the outcomes are so much better just in the last 10, 15 years. Mm-hmm. What were the areas that you're really excited about?
So my area of expertise is the cardiac floor, and same goes for that. There are so many heart conditions that they used to tell parents, go home and love them as long as you can. There's nothing we can do. And there are things that we do now, and they live long and relatively normal lives, as normal as they can be. But for example, Paul Cardall, he had hypoplastic left heart, which, so like before they would just say, you have this much time. I don't know how long they'll live. And he's like old and has this musical career that's incredible. And they just keep on perfecting it. It's just like amazing what they can do for these kids with these complicated, complex, and it's different. Like, it's not just like a one thing fix all. And so I agree with like the healthcare workers and just their passion and commitment to caring for these young people and taking the time to do it right.
Yeah. And their hearts are like this big.
Yes. It's like,
crazy.
We think chopsticks are hard. Like, think of what
right?
they do with like these like little tiny things.
I wouldn't want to do it.
Is Primary Children's, is that a hospital where people come in from all over the world, physicians and nurses, to train there and learn?
Yes.
Is there a teaching component?
Mm-hmm. Absolutely. Yep. From the University of Utah, schools from all over the valley. I don't know about all over the world. I would guess. I guess I don't know. But I mean, for sure, there are doctors that have they're going to school at University of Utah or one of these places where they're from all over the world, and they're doing their training there at Primary Children's.
That's fantastic. That makes you feel great about the state of Utah. Yeah, right?
So one of the questions that I wanted to ask you, coming back to our conversation that we were having earlier, so I saw on social media something that was said that really triggered me, and I usually don't engage with the social media posts, but something that really triggered me, because I do have friends in the medical field and the medical world. They were saying that our medical professionals, if COVID-19 is so terrible and so bad, why aren't there more medical professionals that have gotten it or have died from it? And I was like, well, they're protected. Like, they wear, and I use the word spacesuits, and I know that it's not necessarily the spacesuits that you see in like the movies, but I was just trying to like keep it light and not like, but it's like, come on guys, like, because obviously they're trained for this, they're protected. So from your mouth, and you already said like you wear the masks and but what else are you doing to keep yourself protected so you can't get this virus?
So one thing that they've told us to do is even wear masks at home to get used to not touching your face, because really it's like your face, you touch your face and then you touch things, and that's how it's spread. Washing your hands a ton, bringing a second pair of clothing to the hospital that you change into before you leave, putting all of your things, including your shoes, into a bag. And I come home, my husband, like, we've had to change things up, because usually when I come home, my kids all like run and jump on me,
Yeah.
And so it's like now, I'll come in the house, I let them know I'm here so we can like distract or move the kids, walk upstairs, put my stuff in the wash, and he has the shower going for me. I go in the shower and I shower off. Doing things like washing my hair.
That's so sweet.
Right. Washing my hair after every shift, which was not a thing I did before, just because it's everywhere. Another thing too that we don't actually have in Intermountain hospitals yet, but they are sending to us. It's like a clear protective shield, basically like a clear tarp, that if you are performing CPR or something on a patient that has COVID-19, you actually put that over them while you're doing that, because they say even with compressions, that force is, you know, generating droplets to come out onto you and the healthcare workers. But I will say there are people and healthcare workers that have died. One of the men that I went to nursing school with, one of the respiratory therapists that he works with is currently on a ventilator from COVID-19. So, I mean, yes and no. And then there was that man in New York that died. That was a nurse in his like 50s. So I don't know that we just don't, I mean, I'm sure there's more than we're aware of that are passing away or being affected.
Oh,
directly
the numbers are
worker.
extraordinarily high for healthcare professionals. So
yeah. Mm-hmm.
This individual is not a high information person.
That's why I try not to engage with these conversations, because so many of them are going either based off of what they're hearing on social media or based off of what they're hearing, whichever news channel. And I know that there's a lot of fake news out there. I know that, or the media, like, you know, overdoes it. I get that. But at the same time, I also know that there are so many things that we don't really know, or we'll take one person. I mean, there's another thing, this whole conspiracy theory thing, because one man got on and said, I used to be a scientist, and this is basically my feeling about this whole thing. And it took off like wildfire. And now every single conspiracy theorist is like, this man is, and they put him in the same category as everyone else. Like, basically, he knows all the answers. No, he doesn't.
Because he's a scientist.
One person, right. No one person knows all the answers. And that's where I'm like, nobody really knows, which is why not protect yourself while you can, and stay safe, and don't go to protest rallies, and don't go to these things, because you don't know who's sick that's standing next to you. I don't trust people enough to do anything like that.
You know, and the thing that's sad about that is I do feel like, and maybe I'm wrong, that it's more the healthier population that wouldn't be as likely to be like dramatically affected by it if they were to get the sickness, but aren't taking it as serious.
Right. Oh yeah, absolutely.
And those are the ones that are spreading it to the people that are going to be affected and that it could take their life.
Yeah.
So that it's just, you know, I think people get into the thing of like, well, my freedoms are being taken away, blah, blah, blah. But like, just come to the middle and just, you know, if don't do it for you, do it for someone else. And if all of this is for nothing, then oh well. Like, you know, it's better to be over safe, I think, than.
Well, and I get it. Like, I'm getting stir crazy as well. I want my friend. I have friends in small businesses that are suffering right now that I really hope that we can start opening up again. But even in that, like, it is scary. It's scary for them. It's scary for us. Like, but it's those, like you said earlier, like the extremes of each side. Like, why do we need to have the extremes if we can just compromise and come to an understanding? Maybe we can figure this out a lot faster than if we're just going to be like, you're taking away my freedoms. Well, not really. Like, that's,
and I'm not against things starting to open up. I do feel like the numbers are looking better. I just think we need to be conscious and have certain restrictions in place when that happens, and then continue to watch the numbers to see if something happens.
I agree. Trip, what are your feelings about opening up?
We're messing with fire, and boy, it just seems that if we could wait out 1 or 2 more weeks, it would be a lot better off. And this bifurcated approach where Davis and Weber County are going to open up scares me. What they're doing down in the state of Georgia and Oklahoma, and you know, Georgia's insane. They still have they have not flattened the curve at all, and yet they're opening everything up. I think that, you know, human lives, trading jobs for lives doesn't make a lot of sense.
Yeah.
And I agree with, I mean, the thing is too, they talk about the economy a lot, which yes, the economy has suffered, but also if we didn't do anything and we're all dying, you know, there would be an economy suffered from that too, you know, from the suicides, the depression, all of those same things would go up. with people dying. So
Right. That's a great point. And actually, Megan, we're getting close on time, but I want you to tell us real quick about your business and what you're doing, because I know you mentioned it earlier. I just want to give you the chance to tell, because I think it's a really awesome thing that you're doing to give back as well. So tell us a little bit about your business.
It's a business that was actually started here in Utah. 2 moms in Utah started it. It's like an activewear, leisure wear company. It's something that I started back in September, and it's what's going to give me the ability to work less as a nurse. I love being a nurse, but I also have 4 kids.
Right.
So working once a week as a nurse would be my perfect balance. And that was going to happen in May, but my husband's job has been directly affected by this. And so we are solely relying on my income right now. So I'll be working full-time a little bit longer, but just being involved and being in the middle of this and knowing that there are so many people that are being affected directly financially, with their health, etc., and the healthcare workers that are in the middle of it, I wanted to still give back in a way. So I decided for the month of April, any purchases made in the month of April from my activewear business, I'm giving back to the relief aid of COVID-19 healthcare workers. I've already talked to a few people, talked to coworkers that are in New York, and kind of have things in the makings of how that will look.
Well, since I refuse to wear normal pants anyway until this is all over, and maybe even, you know, moving forward, I'm definitely going to be making one of those purchases this week. So you're going to have to remind me if I forget, like April 30th.
Yeah. And they do have something for everyone, men, kids, like you don't have to love to exercise to love their stuff, and the quality is real good.
Awesome. Well, Megan, thank you so very much for coming on and telling us your story and giving us some insights that I know not a lot of people are privy to. So thank you so much. Thank you, Tripp.
Yeah, thank you for having me. I appreciate it.
Yeah, Megan, you are a great guest. This is by far the best show that we've done this week.
Oh, stop. You say that to everybody at the end, don't you?
Yeah. All right. Well, I'm Shalise Stevens. I'm here with Tripp Mitchell. And again, thank you so much, Megan Walker, for being on our show. And I hope you guys all have a great week, and we'll see you next week.
Okay, thank you. Bye.
Bye-bye.
Bye.